The Pulmonary Associates of Corpus Christi was established about 12 years ago, and the reason for creation was an effort to try to bring the best of the best in pulmonary and critical care and sleep medicine practicing physicians to Corpus Christi and coastal Bend area.
So pulmonary medicine is a subspecialty of internal medicine which involves the diagnosis, management and treatment of disorders of the respiratory tract. There are some common pulmonary disorders as well as some other disorders which are rare, and we as a group here at Pulmonary Associates of Corpus Christi are well versed in taking care of all those patients with those kind of disorders.
We are trained for special procedures like endobronchial ultrasound, where we put a tube down the throat with an ultrasound. Using that, we can get some samples from a deeper part of your lung and the mediastinum. There's also a special bronchoscopy called navigational bronchoscopy, which is something similar to using the GPS system to get to a lung nodule. Those are two additional things I would add to your pulmonary medicine section.
I agree with you, Dr. B, but one thing for the patient's sake, I can tell you, this is a great advancement in the medicine field. What really has happened is that some of those things what Dr. Pulitsingala was mentioning, we had required surgery. So your loved one has to go to the operation theater, go under anesthesia, get surgeries, be in a hospital for several days. We can diagnose those same thing which has required surgery by just getting an outpatient procedure without any surgery. They come to the hospital in the morning, we do the procedure, in 2 hours they're home free. So that has been a big technological advancement. On the other hand, if you look from the medicine part of view, we know a lot of our patients have asthma. This community has a very high incidence of asthma. We are on a hot spot for asthma in the community, and there has been a lot of advancement. We have some of the medicine called biologics, which has made a significant improvement in their overall condition. So I would definitely agree. We have some advancement in the technology, and at the same time we have some advancement in the medicine which can help to treat the patients. The sleep medicine is one of the specialty of the internal medicine. What is happening is that it's a very significant community problem. 40% of the population in this country are suffering from one or the other sleep disorder. So either you have a difficulty in sleeping, you're sleeping excessively, or you're stopping to breathe during the sleep. So if you're stopping to breathe during the sleep, that can have a significant consequences like having a high blood pressure, diabetes, stroke, increased pressure in the lung, and that can be a very significant health related problem.
I totally agree. That's a great point. Okay. Especially since we have a lot of patients here struggling with the obesity. The point Dr. Surani brought up about sleep apnea or stopping breathing at night is very important. You can drop your oxygen level at night as a result of that, and this could lead to a lot of complications like heart attack, strokes. So the treatment is very simple. All you have to do is to use a CPAP machine at night, and if you have any more problems apart from sleep apnea, we certainly can take care of that.
I think that's a very good point. I feel that this is an under-recognized problem. Also, a lot of patients think that this is only a problem with sleep, but as you two have mentioned repeatedly, that it has dire consequences on other organs of the body. So I think it's very important to diagnose as well as treat sleep apnea if it is present.
I guess I'm getting a message. I need to go and to the jogging track and start losing weight. Got it.
Go get a CPAP.
Or get a CPAP if I have a sleep apnea. That's a good thought.
Yeah.
If you look from the sleep apnea point of view, the sleep apnea is more common, as Dr. Pulitsingala mentioned, in somebody who's overweight. And one of the things is normally when we sleep, the tone of our muscles in the neck goes low. When we go in our deep sleep, that we lose the tone. So if you imagine if you have a very jumble of space and you lose the tone, the airway collapses. So the air cannot go in and out that good, and the body doesn't like it. Then your oxygen level goes low, you start making some funny noises in the sleep, your neighbor is knocking on the door, come on, stop snoring. And this is a time, if you're having those symptoms, sometimes if you ask the patient, they don't know that they're sleeping, they don't know what's happening. So information from the spouse or somebody who's around the patient is very, very important. So that is something which patient or their family member needs to keep in mind, because the patient may not be having a awareness that they're having any of those issues.
As a group here, we basically see all adults with disorders of the respiratory tract, and that's pulmonary medicine or sleep-related disorders. In general, I think, as Dr. Surani had mentioned previously, that asthma and obstructive lung disease overall in South Texas and in the coastal bend area is very prevalent. We see a lot of patients with obstructive lung diseases as well as other lung diseases, including restrictive lung diseases, patients with pulmonary hypertension, patients with sarcoidosis. And I think as a group, we have all trained in different places where we've seen different sort of lung disorders. There are certain lung disorders that are particular to certain areas in the country. And given the fact that we're all from different areas, I think it gives us a little edge in taking care of those patients because we know how to take care of those patients.
One of the other thing is very important and nice about this group is we work very closely with each other. So it's sometimes what happens is if we have a very complex patient, then we run by with each other. So it's not like patient is getting one opinion. So that person is going in the group, and we try to get an opinion from a lot of our colleagues, and sometimes we meet each other and we discuss in a patient conference. Obviously the patient identity is protected all the time, but that helps us to provide the best care for our patient. And I'm pretty sure that Dr. Vilasangala would agree with us that a lot of the time, I think, for example, somebody need a robotic bronchoscopy, then some of the guys like Dr. Vilasangala and Dr. Anjum in our group have done far more than many others. So we always try to resort to their expertise.